Nicole Chase, and the topic I really love this topic is 10 food allergy reactions that happen in the classroom. We're going to discuss the impact of severe allergic reactions among children. It's become so prevalent, and more and more kids are having allergies. Why do you think of that? Why do you think of that, Dr. Chase? Why is that?
It's a really great question. We're seeing allergic reactions more and more commonly, whether it's from foods, whether it's from insect stings, medications. They can happen to anyone at any age. And overall, we see patients for them all the time. It's our job really to try our best that no matter what the cause is, to really get patients prepared and otherwise ready to deal with a severe allergic reaction, including anaphylaxis, which is a life-threatening allergic emergency.
And it's as a former teacher, I'd have to prepare things where we couldn't bring certain foods into the classroom. It's hard to monitor now with all these types of environmental allergies, right?
Absolutely. And just think about those, patients and families that deal with food allergies. It's an overlay to their entire life. So every time they sit down to a meal or go outdoors, they're always thinking about the fact that they could be having a severe reaction at any time. And so we try our best as specialists really to empower these patients to feel confident that if they do have a reaction, what they can do is take epinephrine at the first signs of symptoms, not only to treat those symptoms, but also to stop progression of the reaction and really to decrease their risk of an adverse outcome. And, historically, part of the issue for us has been that we've had epinephrine for a long time, the treatment for these reactions, but we've only had them in auto-injector forms, which means that you have kind of a device with a needle that you have to administer into someone's leg muscle to actually give them the medication. And as you well know, most people don't really care for needles, and that oftentimes in the situation that's an emergency can lead to either delayed treatment or even no treatment at all. So I'm excited, especially this back to school season, to offer patients a new medication that was approved just this past year called Neffy. And this is actually a needle-free treatment option, an epinephrine nasal spray for treating those allergic emergencies in kids and adults 4 years of age and older.
And what types of allergic reactions? Severe ones with
So
this nasal spray.
yeah, we're really trying to move the field forward in terms of if someone even thinks that someone's having an allergic reaction, even if they're not certain what the culprit is, or even if they're not certain whether it's truly an allergic reaction, if they're having any of those signs like hives, difficulty breathing, having any type of vomiting, or even nausea, feeling dizzy or feeling like they might pass out, any symptom where you think, gosh, this really is something that could be part of that anaphylactic reaction, we want them to use epinephrine first and use epinephrine fast. And
Mm.
now with this Neffy available, in two different strengths based on weight, whether someone's 33 pounds or more or 66 pounds or more, it's actually something that you can just carry, even in your pocket or your pocketbook. I actually have a demo device here, and you can see that it's very
Wow.
small, very portable. Nice features of this include that it actually will fit into someone's pocket, right? So you'll actually be more likely to carry it, but it also is very temperature stable. So as high as 122 degrees Fahrenheit. And it also has an expiration that's typically between 24 to 30 months. So really lasts for a while. When it's administered, associated side effects are, I think, quite mild: nasal discomfort, headache, runny nose. So we're hoping that with this advent of Neffy, that patients, parents, caregivers, coaches, etc., will really be more likely to actually treat when a reaction occurs versus waiting to see how things play out.
What's really interesting in this is the fact of the before what epinephrine you had to do it. The EpiPen, just for people that know that. Now it was like coming to me and said, "Okay, now you're bringing me back." That is not a really fun uh thing for a kid with an allergy kiddo to carry, or even and when we go on a field trip to have one of the teachers carry versus something like this. Is this going to make people react quicker to give Neffy compared to an epinephrine pin where they're like, oh my gosh, the person has to be dying before I even consider just sticking somebody with it?
Yeah, I absolutely agree with you. I think that there are so many people that just the idea of carrying a needle around with them just makes them feel uncomfortable, gives them a little bit of anxiety. I do think that the size is very bulky. We have kids that are out, playing sports or in a summer camp where there's just no good place to stick an auto injector. They're really just a lot larger. So we're hopeful that with Neffy that patients can, talk with their providers about getting it. And if they're able to, really they can have an option that's very portable, very easy to administer, where you really don't have to kind of hurt someone to help them, where you're not causing them any pain otherwise from just giving them a nasal spray. And as you know, allergies are really prevalent. So most people these days have probably either tried a nasal spray in some form or another. So this just seems like a natural extension of now this epinephrine medication being available in this form. So yeah, I hope it really does encourage patients and caregivers to really just, without hesitation, just give epinephrine, not waiting until you're having those severe symptoms like trouble breathing, but do it early when you see hives after an exposure. Why wait for those other symptoms to actually even occur?
Yeah, and that's the point. But I think this is amazing that they came up with this. I mean, and how many pediatricians know about this and allergists know about this ability now to prescribe this? This has got to be
Yeah,
very
so
exciting.
it is exciting. I think, the initial FDA approval came last August for the dose of 2 milligrams, which is for patients who are 66 pounds or more. And then just this spring, we have the approval from the FDA for children 4 years of age and older who weigh at least 33 pounds. I know that my allergy colleagues are aware of this, are making this an option for patients. Look, we don't want to tell people what to do. We just want to give them choices. And so if Neffy is right for them, absolutely, we can send this to their pharmacy for them to pick it up. I do think that more and more pediatricians are becoming aware of it. And I really hope that by, programs like yours, getting the word out for parents to even request information about it or to talk about it with their providers when they go in for those back to school well child checks or their annual allergy visits. It's really something that I think many of my patients are coming in asking me about before I can even tell them about it.
All right. I mean, this is very, very interesting. Best place people can find information. Where can they go?
So, other than talking with their own individual treatment provider, they can go right now to neffy.com, and it's Neffy.com.
All right. I mean, something you learn every day, right? And something new. But I mean, it really brings me back to that. But it's great that that's options out there. Hopefully, a lot of medications soon will be in that type of format for everyone because it's very difficult when you use needles. And I'm sure,
Yeah,
as your research has shown, any type of needle thing from even, let's say, people with diabetes or wherever, they don't want to do it. And if you can make it
yeah,
an
it's
easier process, you get people to more participate and not have life-threatening things happen, God forbid. So we appreciate it.
absolutely. Yeah, we really are excited to meet people where they are and then really make certain that we don't delay treatment for anybody, that everybody gets access to epinephrine as soon as possible.
All right.
So thanks so
All
much.
right. You're listening and watching the Neil Haley Show, and we'll be back in just a moment.